Getting ready to leave.
I like to pick and see what people do.
What's going on at your parents' house? Oh, they're having a bunch of people there? Yeah, they're having a big Sunday school shindig or something. I've forgotten what it was today.
Probably 25 people. Not bad.
Looks like they're having.
I bet there's 100 people.
Yeah, it looks like a wake. Looks like a wake.
Yeah.
It's a Sunday school. Picnic. Yeah.
And Jim's speaking, I'll come up. That's not big news.
Yeah. The only reason I knew about it, he come over the weekend and bought a table from me and yard stuff. I tell him he's scared. I mean, if they scared you.
Yeah. Well, my first thought was something could happen. You don't think that.
Yeah, no.
When the house got really original too, and there's 10 or 12
I bet you can stop by there after this and get some catfish. Yeah. Oh, I bet they got salad. That's right. He's on vacation, yeah, out of state.
Call this meeting to order. I've asked Mr. Moyer to lead us in the invocation and prayer. Let's pray.
Father God, we thank you for your goodness and your mercy and your kindness. And we humbly ask for permission to enter your throne room this afternoon, Lord. We pray that you will lead us, guide us, and direct us as we conduct the affairs and the business of Faulkner County. Be with us. Help us make the right decisions. In Jesus' name, amen. Amen. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Secretary, would you call the roll?
Yes, Your Honor. Allison.
Here.
Boyer.
Present.
Brown.
Here.
Higgins.
Here.
Kendricks.
Here.
Knight. Mahosky,
Present.
Moss,
Here.
Pearson, Pickett,
Here.
Rowland, Shaw,
Here.
Strain.
Here.
Thank you. I need approval of the journal under tab 1, if you turn with, look at the minutes of the journal from 2 nights ago. Any corrections, questions, all that you see in this journal.
Make a motion, we approve the journal.
Second.
Motion been made, second for approval of the journal. Journal briefly, is there anything you may not have seen it before? Hearing none, all in favor say aye. Aye. Any opposed? Please turn with me then. Oh, wait a minute. We have items on the agenda tonight, and is there any public comment on the item on the agenda tonight? We'll hear from it right now from the public. Comments on it? Hearing or seeing none, we'll move on. Go to old business. Turn with me to tab 2. Correction, tab 3.
Your Honor, I'd like to make a motion that, we accept revised ordinance 2119 in tab 3.
Second.
Motion been made, second. Accept the revised ordinance 2119. Counselor, would you read the ordinance?
Proposed ordinance 21-19, sponsored by Justice Higgins. An ordinance being titled as a health and safety ordinance for the mitigation and prevention of COVID-19 in the Faulkner County Detention Centers. Be it enacted by the Quorum Court of the County of Faulkner, State of Arkansas, the ordinance being titled an appropriation ordinance to amend and supplement Faulkner County Ordinance 20-32 dated December 17, 2020. Whereas, due to the COVID-19 pandemic, a public health emergency exists in Faulkner County, and whereas in the past year, multiple outbreaks of COVID-19 have occurred in the Faulkner County Detention Centers, Unit 1 and Unit 2, and whereas the Faulkner County Quorum Court seeks to mitigate and prevent the spread of COVID-19 amongst vulnerable populations. Specifically, the Faulkner County Quorum Court seeks to mitigate and prevent COVID-19 from reoccurring in Faulkner County Detention Centers, and whereas the Faulkner County Quorum Court believes a financial need exists within the Sheriff's Department to provide 1. Services that facilitate access to health care. 2. Additional emergency medical services. 3. Emergency medical transportation. 4. Additional telemedicine capabilities for COVID-19 related treatment. 5. Communication enforcement, COVID-19 protocols within the detention centers. 6. Additional protective equipment. 7. Technical assistance to the Sheriff's Department to help mitigate COVID-19 related threats. 8. Enhanced public health data system. And 9. Provide mental health, substance misuse, and other behavioral health services. Now therefore be ordained by the Quorum Court of Faulkner County, Arkansas, Section 1, $384,999.96 is appropriated from Criminal Justice Fund 3407 to Department 0421 Criminal Justice to Expenditure Code 3009 Other Professional Services.
You've heard ordinance read, proposed ordinance read. The floor is now open for discussion, and I yield to Justice Higgins.
Thank you, Your Honor. So pursuant to our meeting the other night in our discussions, part of our concern is how do we pay for the situation that we find ourselves in. And we know that we're not quite there with the American Recovery Act, but we know that there's money coming in. We know that it can be used for COVID recovery, COVID preparation, COVID prevention, but we don't have the final guidance on that yet. So I visited with Councilor Murphy. I've been on several other calls in my capacity on the AAC board, so I know there's some guidance coming down the pipe. For those of y'all that don't know, the AAC has actually hired a consultant to help guide them through this, guide them and therefore all 75 counties through this. So this is a little bit of the guidance we had. So I asked and visited with Councilor Murphy to work up something so that we could position ourselves so that when the time is right, that we could utilize the American Recovery Plan to help pay or to pay for the situation that we're in. And not only maybe just for now the part-time, the rest of the year, but also for the next couple of 3 years. Now we also know that the American Recovery Plan is not perpetual, it's not forever. That money will run out and there's a time limit on it. So at some point, we'll be on our own to deal with it. But my concern is we have, seemingly we have a very serious situation that is under time constraints that we need to deal with now. So I think by helping position ourselves to utilize the American Recovery Act plan is probably a wise move on our part.
Other comments on the proposed ordinance?
Got a question, Judge. Justice Higgins, do we have it in writing that we can actually, guidance that we can actually use this, what you're proposing, or is what you're asking completely hypothetical?
It's not completely hypothetical, but as I mentioned, we don't have our total guidance.
So we're hoping that we can use it.
Yes, there is a degree of
Uncertainty.
risk. Yeah, uncertainty, risk, yes, there is a degree of that.
Okay.
And to also add to that, just Kendrick, the 1 through 9 that's outlined there on the preamble has been taken from the regulation that has been established, or at least is in the process of being established. So almost verbatim, there's probably a list of 20 COVID-related items that can be used under the American Rescue Plan funds. We simply felt that 9 of those were the most pertinent to this particular operation. So, assuming those regulations are finalized, then this would give us the best chance for getting the most amount of recovery.
Okay, now are these specifically listed? Does that mean we can utilize that funding anytime we have these items that come up, or can it only happen if these items come up and they are actually COVID specific, dealing with a COVID patient or a COVID inmate, something like that?
Okay, so your first question was it specifically listed? And yes, it's specifically listed. Then to your second question, is it going to be on a case-by-case, or rather it can
A blanket or a
blanket?
case-by-case?
And the answer is, I don't know. I think, well, let me just say this. I cannot say with 100% legal certainty that 100% of any contract price for a new vendor is going to be covered under the rescue plan. However, I think that we have a good chance of getting many pieces of the new medical plan covered by the rescue plan. For instance, mental health services, or providing mental health related services, something that's specifically outlined as a regulation, and that's something that's specifically part of the current proposal. So do I feel very confident we'll be able to get the mental health aspect of this covered? Absolutely. If the medical provider has COVID-related responses, then yes, those are allowable or compensable expenses. I'm not sure if that's going to be blanket or by case by case. And the truth is, we're still working with the vendor to adapt their contract to be more COVID related, to try and help us get the maximum amount allowable down the line. Because what's going to happen is, here in a year, that rescue plan money is going to be sitting in a bank account here in Conway, Arkansas, and we're going to have $24 million. And then we're going to have to decide how much do we think from the sheriff's office and other offices, but for this point, for the sheriff's office, how much of the medical services are going to be allowable under the rescue plan. So once we make that determination, then a transfer goes from the rescue plan account into county funds. In this case, it goes right back into the criminal justice fund. then later on, there's going to be an audit, a review. And so the Department of Treasury, I guess, is going to be involved in that audit. And they're going to look and make sure that the county was spending the allotted money on things that have been covered. This preamble to the ordinance, I think, will help in any argument in the future that as much as possible the services are going to be COVID related. I would, once again, it's not bulletproof. There's a chance that they could follow this up and say we don't care, we want to look at the actual services, but this just gives us a better argument.
Okay. I guess the last question related to this, if all of our hopes, wishes, and dreams don't come to fruition, is the sheriff's office prepared to absorb the additional $500,000 a year to pay for this? And that would be a question, I guess, for the sheriff's office.
I guess that would be a question for the revenue. At the way we stand now, we do not have that to be able to compensate exactly where we stand at right now.
Within our criminal justice fund.
Within criminal justice.
We have other funding available to us. We have smaller special revenue funds within the county, and then we also have county general. I understand county general is the big pot of money, that everybody gets a piece of that pie, per se, but we have every right to that as everyone else.
So, since I still have the floor, just a couple of comments that I would make is, one thing that I have learned in reviewing the American Recovery Plan is that we can't be reimbursed for things. So if we went into this without this preamble and then later said, oh, that might qualify for the American Recovery Plan, we can't come back later and ask for it. But as we endeavor to go into this agreement and we prepare ourselves with this, then that makes it potentially eligible if we're doing the right things. You know, I'll tell you also, one of the concerns with the in our AAC meeting that I learned is that apparently there's a lot of feedback that there are vendors who believe that they can provide all kinds of services. I'm not specific to what we're talking about tonight, but all kinds of services that may be related to American Recovery Plan. And the counsel that the AAC is providing counties right now is don't get ahead of your skis and get into these services because we may not know. So one thing that we know also is that the Treasury Department is not going to be providing pre-approval ever through this. So it's not like any, again, not related to just this, but any plan that we come up with, we can't say, hey, let's call up somebody at the Treasury and say, is this going to be approved? They're not doing that. What they're doing is they're providing the guidance, and then counties can look at the guidance and say, we believe that that meets the criteria, and we're going to endeavor to spend that money accordingly. And then after the fact, they may or may not do various spot audits. So it does just cause a little bit of queasiness. And, you know, especially if there's a large project. What if, you know, there was a multi-million-dollar building that we wanted to build and we wanted to use this money, and you get into it and at the tail end of it, they say, no, that doesn't qualify. The county would be on the hook for that. So that's why we do want to be careful. So that's why this wording specifically is utilized with the guidance that we currently have out of the American Recovery Plan. Justice Gordon.
Justice Higgins, I'd like to think that the history that we have already with COVID, COVID-19 from last year would be a substantial evidence or proof that we're not creating a pandemic here. It's already in. And I don't know, do we have any current COVID patients in the year 1 or 2?
We currently have one that tested positive this week, but as of last month, we had 70 that tested positive.
So this is not something that we're making up to qualify for the American Rescue Plan. This is ongoing now, and it could be beneficial now if the American Rescue Plan was in effect now. Is that correct? Our history would substantiate that.
That is correct. That would be a fair assumption.
Yes.
And to piggyback on that, I think some of the things the vendor was talking about, assuming that the sheriff uses the vendor that has been in discussion, but things like the electronic data information, that's something that's covered under the rescue plan. things like some of the telemedicine concepts, anything that new that can be part of the COVID prevention is something that can be covered under the rescue plan. So once again, I'm not here to say that 100% of the contract price will be reimbursable, but I do think that by adding this, you give us a better chance for making that argument years down the line, when and if there is one.
This figures at the last county judges meeting this week, the term public health was the #1 area that got the rescue plan. It was tied to public health. It would be the #1 area that the money could be used for. Not basically new stuff, but trying to get a handle on, a grip on it and all.
Right.
We have talked to two vendors that have talked about our ventilation system in the courthouse, in the jail, and all could be purified. The system itself, without putting in a new system, and all, just the discussions, all we've done. We think that would qualify. For example, we'll come to you with it if we decide to go that way, but it might be a big help. Cleaner the air, less chance for COVID. If it's been purified. Other comments?
You know, I think it would be probably fair that as we go forward with ordinances, again, for various things, if we can utilize the guidance in the American Rescue Plan to do so on lots of different areas.
Judge,
Go ahead.
are you?
Yeah, that's it.
Okay, thank you. While we're on the topic of COVID and how you've preambled our ordinance here, for the sake of the discussion on the topic, I want to make a motion to amend this ordinance to change the appropriation from the Criminal Justice Fund to the Coronavirus Relief Fund.
I'll second that. What if we don't get it for a few months? No, we quit. What if we
Yeah.
don't get it for a few months?
I have no idea when we're supposed to get it.
Well, I don't know.
This is the current,
Tying our hands.
the CARES Act.
Tying our hands.
With the CARES Act,
We don't have the CARES Act itself. You said that. I thought you said.
well, that's the name of the fund that it's in, is that right?
I'm gonna have to ask, where is Jenny? Jenny, what is the name of that fund?
We have
CARES Act.
The CARES Act is, we have the Corona CARES, which is what we got for the state last year.
That's the one I'm looking for.
Yes, it's the Coronavirus Relief Fund.
Okay.
That's the one. The one that the money is in the bank is the one that I'm motioning for. And you seconded it, sir? All right. May I discuss my point, Judge Baker? All right. I have a jar of pickles here, so I'm going to make a joke.
Watch it.
We find ourselves in a pickle. Thank you. With this situation. Many times in this county, we've found ourselves in a pickle just since I've been in the court, much less in the time that I've been watching the court and other members have been on the court. There's not many times in this county where we've had an extra $1.2 million gifted, or close to 1.3 gifted to us from the federal government for taking care of things. I see this as benefiting us in a couple of different ways. One is that there's besides in the hospitals where they're dealing with COVID patients, there's been no other ground zero for COVID worse than our jails, I believe. And the medical people in the jails are the ones dealing with this, the inmates. It's just it's a bad situation. Even mentioning that last month we had 70 COVID cases in our jail as the rest of the state of Arkansas has opened up and we're all here smushed around these tables with no masks on. But also we chose on Tuesday to delay this 2 days for more information gathering for the sheriff. I think someone mentioned the sheriff could maybe provide a couple of options for funding this, or we just need more information to make an educated decision. One thing that I see this doing is we've been given a gift of COVID money, and at the same time we could use a portion of that gift, not even a majority of that, money to buy us more time to come to a better a solution. You know, there's no doubt, I believe, that this solution that we're seeking for this $700 and some odd thousand annual expense is a increase in service that we provide today. Like, I think the way the sheriff's office is talking about it, it's a better service than what we provide today. Maybe that's what we need, maybe that's not what we need, I have no clue. But I think that using this money from the coronavirus relief fund, 1,005, can buy the sheriff some time to do his homework, can buy us some time to think about it, and to come back during budget season and decide what we want to do as a county moving forward and how we want to handle jail medical and deal with that from both a service level perspective and a funding perspective, because we talked about last night the different challenges that the sheriff's office funding faces, and like Sheriff Riles says, the revenues are increasing, but they're not nearly increasing at the rate of expenditures. That's why I make this motion to change the funding. I believe it just buys us time with money that we've come across.
Restate your amendment. Restate that.
Yeah, my motion would be to amend section 1. I would strike the words Criminal Justice Fund 3407 to Department 0421 and replace those words with Coronavirus Relief Fund 1005 to Department 0400. I stole that wording off of the ordinance that was included in the packet of information for Tuesday's meeting.
The amendment has been seconded. Floor is open for discussion on that. My first question is, Counselor, is that something we could reimburse from the CARES of money that's coming from the federal government?
The rescue plan can reimburse wherever it comes from.
That's what I'm shooting for.
Yeah, it can reimburse whether we pull it out of any fund. That doesn't matter.
Excuse me, Judge, yes. You talk about the federal, you're talking about the American Reserve Plan can reimburse?
Rescue.
Is that what?
I'm gonna make sure that we can reimburse this money from the 24 million we're supposed to get on our hands, and that's why I was asking.
And let me just, for background, you can get whatever reimbursement's going to happen will go back into the fund in which it came from. So, for instance, if we pay the medical portion out of the coronavirus relief fund, and later the rescue plan reimburses us a certain amount, that will go back into the coronavirus relief fund. And y'all can do whatever you want with it there. Let me just caution, the coronavirus relief fund is unrestricted. You can use it for anything. The other thing is, the coronavirus relief fund is there based on the hours that county employees put in during COVID, from May or January through whenever we had to upload all that data. So I would, this is not legal advice, this is just a county employee who has heard from other elected officials and county employees. Many county employees have looked at other counties, and they've received COVID bonuses out of that CARES Act. And so many county employees are patiently waiting, hoping that their service during a time of national crisis that helped build that account would then later go provide some thank you for those employees. But once again, it is unrestricted. You can use it and build a monument in the front lawn if you wanted to. So it's not that you can't use it. It's not that it has to be a coronavirus project. It can go to anything. It's up to this court.
And there would still be $900,000 in this fund, I believe. I haven't done the math, but it's 1.3 million. We're spending about 400,000.
After this year, yes.
After, yeah, just,
Follow-up question.
Yes.
Does the Justice Department have $384,999.96 in its account now?
Criminal justice sales tax has unappropriated approximately $414,000 in change. And if I can make a statement, we did submit documents for all of our essential personnel that fell within the CARES Act, and it totaled for only 2 of our 4 payrolls, $1.5 million. That was only 2 of our 4 payrolls. So we are completely within reason for asking for this for services for our department, but I do, as a county employee, appreciate what Mr. Murphy said. We did all work in that environment, and so we should, as other counties, be awarded that opportunity as well. But we have to take care of people of custody, or in our custody as well.
Jerry, you got it?
Well, what I've heard take place now is we have introduced another source of spending money that's not related, actually related to this ordinance at hand. Is that correct? We're not here to discuss bonuses for employees of the county. That's just potential use for the CARES Act fund. Is that correct?
If I can reply to that, Justice Boyer, I think my intent here is that wherever we spend the money from tonight is to try to apply the American Rescue Plan money back to that. I mean, we can get it from Margaret's budget for all I care.
Margaret had an objection.
The plan would be to give it back to Margaret. So when we use the word reimburse, I want to be careful. Reimburse would be, we're gonna reimburse for what we did last year or previously. Really what we're looking at is applying. So what we want to do is we want to apply the money that's coming, we want to apply it to this. I mean, I get it, it's a reimbursement because we're spending it, we're going to apply it to this so that whatever department or whatever fund we pull this from, we can make it whole with American Rescue Plan money. Does that help?
It makes it a little less foggy.
Yeah.
But we still don't know for sure that the American Rescue money will be applied to the coronavirus monies that we use instead of the criminal justice fund money. Is that correct? We don't know yet.
No, that's we have the money that Justice Lahowski is referring to. We have it in the bank.
We have that in the bank.
Yes.
And I think I heard the council say that could be used for the employees to supplement their times during the COVID situation. All the county employees, not just the jail, but all the county employees that were impacted.
It's going to be not an essential for county employees, which would be primarily from what you talked about. But
Yes, sir.
So I think again, the reason we haven't brought that up yet, because in my capacity with the AAC, we've talked about it there, and other counties are talking about that. But the reason it has not been before this body yet is, again, we're waiting for more guidance from the American Rescue Plan, from the Treasury Department on that. So it's not that, I mean, we know we got $24 million coming. We know we're going to be able to spend it. We have a really good, man, I hate to use the word, but we have a really good view of what we're going to get to spend it on, which is what the terminology here yet. It's just we don't have that final go forth and spend the money, guidance yet.
Understand. So we have as good a view on returning the money to the criminal justice fund as we do the CARES Act.
Absolutely.
It's a wash on the supposition that we're going to be able to use it for this.
We're positioning ourselves as best as we possibly can to do that very thing, regardless of whether it comes from those two funds or markets.
Can I speak to this, Judge? Yes, sir. One advantage I see of taking this money from the coronavirus relief fund now instead of the criminal justice fund is we've often heard, lots of us on this course refer to the need for increased pay for the sheriff's department employees. And if we preserve that $400,000 unappropriated, we could see possibly an application for raises for the Sheriff's Department in September cycle, where we could use that money, that unappropriated, to provide them those desperately needed raises. And I will just venture a little bit off, but still, talking to people about this animal control, this animal shelter deal, I'm finding out that our jailers are paid less than most animal control officers around the state. And that to me is appalling, it's abhorrent, and I would like to see this $400,000 unappropriated in the future applied toward raises, where it would preserve it. By using this coronavirus relief money now, we can do that and still apply for the reimbursement that you're talking about, just see.
I do, and I don't mean to talk in circles here, but I look at the county as a whole financially. I can't, that's just the way my mind works. I can't just say, okay, we're gonna go with this one right here today, because we have to look at the county as a whole. So it's not our job, we've always been told it's not our job to operate different departments. So in my eyes, I see this as a grand plan versus a affordable plan. While that idea that Justice Lahosky threw out, taking the money out of the CARES Act, I too think that we need to give some bonus money to the, especially to the workers that didn't get to go home, you know, during COVID. We can't forget how stressful that time was for all of them. When we get away from things, we often forget those things. But we also have to remember that this is taxpayers' money. And I think a lot of taxpayers would be upset to know that we are spending the money on the grand plan instead of the affordable plan. One question here, and don't want to answer until I finish my spiel here, on this ordinance 2119, this is an ordinance that kind of outlines, gets us in start with being able to apply with the 24 million that, hey, we do have COVID issues. I think we could do another ordinance that kind of establishes the same thing in the future, that's not attached, that we have these issues and this needs to be done and that needs to be done, et cetera, et cetera. I don't know why all this has to be attached to $384,000. Anyway, I just, you know, we have needs in the county. We've had desperate need for a new jail. We've had salary increased need for the sheriff's office, exactly. We've had operational funds that are going to be needed for the animal shelter. We've got the COPS grant that we don't have funded yet. And this money is only for 5 months. 5 months, and then we're going to have to spill it out again. So my issue is, it's not our job to operate the sheriff's office, and we have appropriated money for him to meet all the guidelines required by the state. Contact with 3 doctors is not enough in my eyes. It really isn't. I really feel like we've got hundreds of doctors out there and nurse practitioners that I feel some of them would be interested in this, and we could still provide the same service. And we could add to that service through this plan of whatever needs to be retrofitted or whatever equipment we might need, you know, et cetera, through this 21 million. Why does it have to be this company? Nothing against that company at all, but it's got a very big price tag on it. So anyway, while it's a great plan, it's not affordable, because we're literally bottoming out our budget. And that I just can't. I always go back to dollar and cents. I would love to be able to do everything every citizen in this county wants, but it all goes back to dollar and cents. So for me to support this even at all, I'm just not there. I'm not there. You know, we've got the COPS grant that we have to fund, and when this 24 million is done, not only do we have the COPS grant in 2 years, we're going to have this full-fledged, and probably going to have the animal shelter that we're going to have to give to, unless a 501c, if that's the correct term. steps up and operates it for us. So we've got a lot of needs in our county, and I hear everybody talking about this. Well, I think that we need to be talking about everything. Because in my household, I don't talk about just how I'm going to make my house payment. I got to figure out how I'm going to make my utility payment too, and my insurance payment. So that's kind of just where I stand.
Yes.
I have concerns on the motion just because it seems to me to be relying on a one-time money for a potentially ongoing expense. I know that's a concern you shared with the court as well. And so I have concerns over the motion for that reason.
Discussion.
Judge, I think I would echo Justice Rowland's concerns and Justice Pearson as well. I certainly understand the logic of the motion. However, for the same reason that the discussion about the animal shelter a few days ago, of perhaps not using that CARES Act money, but since it is unrestricted, use that as the money of last resort. I think that the same logic should apply here. We shouldn't use this one-time gift essentially to fund an ongoing thing that's going to be a year of the budget going in the future. If we're going to bite that bullet, let's go ahead and get it figured out how we need to, but leave that unrestricted money alone. And if push comes to shove, perhaps tap into it later if we have to, but I think it's better to save it for a rainy day.
Oh, I hand moving. Yes, sir. That's your record.
I think that it is a rainy day. Sheriff Riles, you mind if I ask you, are we able to keep the doors open if, I don't know, if we don't have a doctor, are we able to keep those jail doors open?
We are mandated to have medical service in our jail, and to have medical service, we have to have a doctor in order to be able to get the prescriptions and things addressed, the needs within the facility. So, I never want to say we would have to shut our doors. We've still got the inmates that's in there, but I don't know. It depends on what. I can't foresee. I'd say I wouldn't be able to comment on that. I don't know if that would be the case.
Let me ask, is it even plausible for jail staff to be handing out medication?
Well, we are already handing out medication. That's part of what we do. It's unfortunate. We're one pill away from seeing twice as much money we're talking about here coming out of this county. All it takes is that one lawsuit. So we should not be handing out medication.
Right, I think an ounce of prevention is worth a pound of cure.
I'd also like to add to that our officers are passing medication right now. They pass medication 4 times a day. They work 12-hour shifts. They're passing it a third of their time. So that's breaking down the security. They're not being able to be there like I talked about before. So you have one person right now. We're short-staffed, as we talked about. I have 4 officers I have to have in one shift. If I have one person passing medications a third of their time while they're working, that leaves one person on the floors over here at Unit 1.
That's not a lot.
That's all.
Are you done, Justice Smalls? Step on you.
Right now, Joey.
Okay. Justice Pearson, you mentioned before, and I agree. I don't like to spend reoccurring money with this CARES money that we have. But I also want to go to what Justice Rowland said. Jeez Louise. And looking at the whole picture. And looking at the whole picture of the budget. Because when do we do that? When do we step back and look at the whole picture? We do that during budget time. That's our opportunity to look at the whole picture, to look at everything and see where it's all coming from. My proposal in this is that, we've said it before, we don't have control over what contracts are signed and what vendors are chosen. We have no control over that. But is that we can give the sheriff's office money to solve this problem temporarily until budget time. And at budget time, we can decide, is $770,000 an appropriate amount of money to spend on medical services for the jail? And if the sheriff doesn't have that money, well then maybe it's not an appropriate amount of money. That's something that we can see when we're sitting down with the entire budget and take that into consideration. That's why I make the motion is to use this to Band-Aid us until the end of the year, until budget time, when we can get more information and make a better decision on how to fund county medical jail services going forward through the rest of the years. Thank you, Judge.
Other questions, Jeff? Any comments? Do you have one you want to raise? Just for now.
I guess the comment that I would just follow up with is I also would be concerned about it coming from the coronavirus relief fund if we didn't have a high probability or a good probability of having it apply money back to it to make it whole.
I'd like to say too, any good plan is going to have something in reserve. More than the military here, but any military plan will include a reserve force just in case something happens. Go back to the D-Day invasion. We just celebrated celebration of that not long ago. One of Hitler's biggest mistakes there was he had his Panzer division in reserve and refused to deploy it because he constantly thought that there was going to be a bigger invasion force landing somewhere else. We have this reserve money. We are behind the eight ball, so to speak, not because of anything that we can control and support, or that we can argue whether or not it could have been controlled anywhere else. But in about 3 weeks, we have to have medical coverage for our inmates, and this could get us through, like just what Hosky said, to the end of the year. And Justice Pearson brought up something the other day when we were here, that we could use this time, or this time could be used by the Sheriff's Department to explore other options, and by the company to justify why their price is how it is. They told us that they were going to save us money through litigation and through other claims and stuff. They have time in these next intervening months to come up with numbers to show us how exactly this money is going to be a good investment for this county. And right now, the 4th of July week is coming up. I could be here every day from now until July 9th. That's not going to bother me, but I know that some of these people that have been here more than they want to be here this week out here, some of these employees who serve the county, some of y'all may have vacations coming up. That we're in a pickle, like Justice Lasky said, and that this is money sitting here. We have this reserve force. If we don't deploy it, could we be putting ourselves in the same position? Military technicians will never know. Could the Germans have repelled the invasion if they utilized the Panther Force? But like Justice Moss said, we're in a position where we may need to use it.
Judge, I've got a question if I may.
Yes, sir.
Sheriff, at our last meeting we discussed bringing some potential other options, and while we're debating which fund or this motion to potentially change this fund, did you bring us any other options to consider for example, like pared down services, what was discussed and beat around a lot, removing the mental health portion of it? I think somebody brought up the Saline County, they're only covered 16 hours a day, so instead of the 24 hours a day, maybe 16 hours a day, or even comparable to what we have now. Did y'all?
The motion on the table is the fund where the money is coming from, not the amount.
That's correct, and I feel like this is relevant because if that amount changes due to having other options like the court requested, it might change some of the debate, the discussion, and the vote on this. I'm well aware of the motion, but thank you for reminding me.
We're not going to change the amount right now.
I realize that.
So how does debating changing the amount refer to the motion on the table?
Because if we know if there's potential that the amount could change by us looking at the options, it might give us a different perspective while we're voting on this and how much money is going to be removed from the prospective fund.
I'm on rule that we stick to the amendment. Right.
Well, let's take a vote on it then.
Let's don't take a vote on that. I said we're sticking to the amendment, discussing the amendment right now. You can ask for another amendment. That's your prerogative. Let's keep it in the parameters of the amendments that we're talking about.
I think if we vote on the amendment, then that'll open the floor back up to actually address Justice Kendrick's questions.
Sure. Let's try the discussion on the amendment, please, Paul.
So I'm going to come out front first and say I'm opposed to changing the original ordinance, and keeping it with the way the ordinance was presented by Justice Higgins.
Any other comments? Anybody else have a comment? On the amendment itself, if I can read that. Strike out criminal justice sales tax fund, add from the CARES Act funding. I didn't write down all the things, but that's basically the amendment, is that right?
Yes, sir.
Right.
I've got a sheet coming around to you.
Appropriate for the Quorum Relief Fund 1005 to the Department 0400 Sheriff. The expenditure code 3009 other professional services. Okay. Hearing no other discussion, Mark, would you call the vote?
Yes, Your Honor. Allison.
Yes.
Boyer.
No.
Brown.
No.
Higgins.
Yes.
Kendricks.
No.
Knight. Mahosky.
Yes.
Moss.
Yes.
Pearson.
No.
Pickett.
No.
Rowland.
No.
Shaw.
No.
Strain.
Yes.
7
So
noes. 7
7
noes. 5 yeses.
The amendment fails. Like the votes, we're back now to discussion of proposed ordinance 21-19. And I'm going to refer to Justice Kendrick to ask his question.
Sheriff, I guess to repeat myself, we discussed the potential for bringing other options, different levels of services for us to debate. I think it was kind of thrown around that this was a platinum plan because it was such an upgrade from the level of services that we currently have in the jail. Were you able to bring any other plans for consideration for tonight?
Well, we have, a short period of time, we have reached out to vendors. We did contact one vendor. Their prices was almost identical to exactly what Turnkey is. And in fact, this particular vendor, a lot of the jails have gotten rid of them and has went to Turnkey. We have also talked to Turnkey about taking the amount, or actually taking our mental health off of this, and so there was a reduction in the cost of that of about $100,000, I believe.
It reduced the price by $128,000. Hold on just a moment, and I'll actually.
Is that the 100 and some thousand on the annual rate or
Annual
prorated rate?
Yes, so at the appropriation cost right now, it would cut $64,000. So it bring it to $321,000. And so it reduced the annual price, and for the 6-month price. It also, based on the comments of the committee members, or the Quorum Court members, they did up the bed space, or not bed space, the amount of inmates. Yes, average daily population, sorry, threshold from 360 to 400, based on our, to get it more in means with before COVID. So because we are seeming like we're on the downward turn, and we are raising our population little by little, that was some concern, I know, of Justice Brown. So they did put that in there. And then it already does have a prorated section 2.1, where it states that they will not bill us for the whole month of July. They will prorate that from July 9th to the end of July. And I know that was some concern as well. We did reach out, like the sheriff said, to other individual companies. We have not heard back from any of the individual doctors that we've reached out to, but the companies we did reach out to, I know Chief Woolley reached out to a company and had to leave a message this morning. We never did receive a call back before court tonight from them. And then I know Captain Stone, I'm going to let her speak on behalf of the other company, because we did receive a dollar amount from them.
We reached out to Advanced Health
conversation going, and this is ongoing, and this will take some time, but it is something that we're talking to, people that we're talking to. That's Conway Regional. I have a meeting I will be setting down with board members and a doctor and Jason Owens. Hopefully we get it next week or the week, but this right here would buy some time. So we are looking. I'm not saying they're going to do it or not, but they are willing to hear what it is, what we're needing. And so I think there's some pretty good opportunity there. Maybe potentially after the first of the year, or once we get back past this next cycle. So we are diligently looking and we're working, but our biggest obstacle is the July the 8th time frame. I hope that answers your question.
Thank you.
Just Skinner, you have a follow-up?
No, sir, I don't, not right now.
Captain Stone, what's our mental health situation like in our facilities? Can you give us a kind of just an overview of that?
We probably go to about 4 to 5 commitment hearings a week for people that are brought into our facility. And then even once they are civilly committed to a hospital, they sit in our facility until they're able to transport. They go for 7 days, they come back and hope that everything's okay. We've done several commitments on the same person. Right now we have a detainee who we have to separate because he has mental illness and we can't get him help. State hospital has no beds for us. So I know it's bring down, but we would benefit from the mental health.
Thank you, ma'am.
Judge, thank you, Judge. I'll kind of make the same argument for this that I made for the taking the money from the coronavirus relief fund. You know, this is the criminal justice fund. It's funded by sales tax. You know, it's the sheriff's money, just like the road money is the road shop's money. You know, we do have the ability to control how much of that money we appropriate, but at the end of the day, the sheriff is the only one that gets to walk away with it. It doesn't roll back into county general. It just stays within that fund. It'll continue to exist within that fund until the money is spent. And I think with what the sheriff's talking about, and maybe even with the thing with Conway Regional, shows us that there are other options available going into next year. Like I said, I would make the same case that come budget time, it would give us an opportunity to look at the whole picture and for the sheriff to decide, along with the rest of his budget, how much is appropriate to spend on jail medical. If we appropriated this entire amount right here and they were able to strike a better deal with another vendor, I'm sure the sheriff would not spend every penny of this if he didn't have to. Just like Ms. Woolley has said, it takes up a good chunk of the remaining money that they have. Okay, I go back and say, but it's the sheriff's money, and kind of if this is what he wants to try to spend it on this year, I'll asterisk that this year, because we get to decide come November if we're going to do it again for next year. That maybe we can give them this chance to solve this problem temporarily.
I just want to second and concur exactly what you just said. That's where I've been at with this from the get-go. I think it's coming from the criminal justice funds the right place, because at the end of come next budget, sheriff's going to have to reassess everything: the additional cops expenditures, his medical grant, the medical funding, everything, and take a whole new look at it. You know, what I said the other day, probably not very eloquently, was that the sheriff's office is the first target of the trough. I think there may be some other areas that get spent, maybe prosecutors' fund or something like that, public defenders, but primarily this fund is for public safety, you know. And if the elected representative, you know, the sheriff's office is here saying that this is a priority for him for his surplus of tax revenues, and this is how he wants to spend it, and the money is there, and it is for a legitimate and necessary and important purpose, I personally support giving it to him.
If I may,
Let me recognize him first and then come back to him.
Judge. I don't know, is Mr. Owens here?
I don't believe Mr. Jones is here tonight.
I don't know, perhaps, the other members of the court could help me understand. I'm still trying to learn the interplay of the not insurance, but the liability coverage we have with AAC. My understanding is that if the county gets sued, AAC kicks in $500,000, is that right? And anything over $500,000 we then are responsible for. Is that correct?
I believe we have a $500,000 per incident, or actually, first of all, it's a risk management fund, not insurance, and some of that is just regarding the sovereignty of the county and some of the legal technical issues there. But Tom, do you know if it's 500 per person or just per incident? On the
Incident.
So 500,000 per incident certainly for our jail cases.
And my understanding from Mr. Owens earlier in the week was that the reason why he is, as defense counsel for the AC, likes the third party medical is because it helps kind of reduce that exposure of the county when there's an incident, because you've got a contractor you can point to as, hey, they're handling it all, go sue them. Would that be fair, Councilor Murphy?
Yeah, I think that's fair. I think the amount is also higher. I think it's in that contract, if I'm not mistaken, and off the top of my head, I want to say it's $1 million per incident, but it seems like it was higher than 500,000.
Since the AAC is a risk management fund, can someone, how does it, I interpret that to mean as you know, the Association of Counties, if a county gets a judgment, that judgment's spread across everyone, kind of like a co-op. They do the health co-ops now, try to get insurance. Is that kind of how it works?
Yes.
So lots of claims, our premium goes up, not lots of claims, our premium goes down? Is that, or if I say premium, what we have to contribute?
Yes, I think it could. I mean, if there were a ton of claims, then yes, our rates of all would go up.
Okay, so, and this is what I'm leading up to my question is that by going with third-party medical, do we get any kind of rebate or reduction in what we have to pay the fund if there is a claim?
It's based on population.
Yeah, no. The answer is no.
So it's still equal. So if whether a county has third-party medical or they're doing it in-house, we're still shouldering that cost through what we're paying the AAC.
We still got the risk. Risk of those don't go away.
So
there's not a cost savings on the front end. It's only the back end.
Right. So I guess, so one thing that popped in my head is that it seems to me that by going third-party medical and paying for that, we're essentially subsidizing the counties that choose not to go third-party medical and still have their own in-house jail doctor, to the extent that they face more liability and make a bigger claim on the AAC. So I think that is one important thing. And what I'm getting at is, I was hoping you would say, well, as an encouragement to get third-party medical, you get a reduction in what you have to pay. Well, hey, there's some saving, you know, it's great. But it sounds to me like really we're just subsidizing the counties that decide to do this. One thing, I don't like how this thing was handled. I don't like how this was approached to me as a justice of the peace without information. I'm not saying it's anyone's fault, you know, but you know, there wasn't backup plans is where we're at. Just by asking some questions, it looks like we have a potential to reduce this down to that last quote without the mental health coverage is $1,605 per bed for a year on 400 beds. If the purpose of this appropriation is to fix an emergency and get us through the end of the year, then I do not think that would be appropriate to include the mental health on this contract, since we don't have the mental health right now. If we truly just need to keep what we got to get us through until we can sit down and do this right, I don't think we should add that. Now, that is not to say that I don't think that is important. In fact, I told the sheriff this. I think mental health is probably far more important than jails. And that, you know, our law enforcement is essentially the social work, the last line of defense social worker in our society. You know, we need that mental health. But I don't think that we need to do it this way. If this is such an emergency that we've got to meet this need, to keep us from getting sued, to comply with the Constitution and this, that, and the other, then we need to just do whatever we got to do to keep what we got, and then let's come back in the fall and do it the right way, whether it be through bidding, through whatever, when we can actually make a decision to get this extra stuff that we don't have right now. I did take the opportunity to get a copy of Saline County's contract with Turnkey. And Saline County, according to the chart we were given, Saline County's contract is $295, $734 a year. And the chart has 250 beds. That would come out to $1,182.96 a day per bed for Saline County. I think that the amendment to the contract, I guess they've reduced it to 230 beds. So with that new figure, it comes out to $1,285 a bed, $1,300 a day, or a year per bed. Now, the difference between Saline County's contract and ours is Saline County's contract has up to 80 hours of LPN coverage, and then the physician is the same, and then the on-site clinic is the same. So they've dropped the 40-hour-a-week RN, and they've dropped the mental health. And this is what I asked the representative the other day. Can you tell us, to me, this is what we have right now. You know, 2 nurses and a doctor once a week when you need them. And so it seems to me that for Turnkey Health to provide us with what we have right now, we're at $1,285 a bed per year. In my opinion, if we're going to be put in a situation where we have to approve this or else, I think it's appropriate to ask the contractor to give us the same deal. Now, I understand this is what the response is going to be. Well, there's 2 jails. I understand, but I don't understand how having the jail in 2 buildings that are a half mile from each other, if you've got 2 nurses, I don't understand how that really makes it a greater cost of one nurse is working here, one nurse is working there, or they're both here, and in the afternoon they go there, or whatever. Because it's not like we're going across the state or anything. We're here in the same town. How would it be any different than if it's 2 buildings that were separated by 20 feet? That part I haven't understood yet. If we're going to do this, and we don't have time to bid it out, and we don't have time to get our ducks in a row, and we don't have time to look at alternatives and try to save the taxpayers money, my recommendation to the court would be is to approve this at the same rate Saline County is getting, which is the same that we have right now, and gets us through until we can do this the right way.
What if they say no?
Then they say no.
Then we're not cutting medical coverage.
Ms. Wood, you got the floor.
Thank you. I would like to just answer some questions and some things that were said, just make sure we correct a few things so it's not misconstrued. Justice Pearson made a comment that, I can't remember exactly how you quoted you, but you said something to the effect of other departments get criminal justice money. That's not true at this time. There has been another is inaccurate as well. Because whether it's a mile and a half or across 2 cities or across 2 counties, it is very difficult, and I completely will state this as a true fact. I believe that it is a cost increase across the board for our department to be in 2 jails and 2 offices, let alone our medical, and trying to transport prisoners back and forth, paperwork back and forth, everything. It does make it hard logistically. And I know for certain medical, because this contract, this company will offer us that if one of these LPNs are off for whatever the reason may be, it doesn't matter what the reason is, they have a pool of nurses that we will never be without that care for that 12 hours a day, 7 days a week. Right now with our 2 LPNs, if one of them is out for sick or vacation or extended medical leave of their own or family members, we are lax. We don't have that coverage. We don't have another LPN that we have on staff full time to bring into that aspect. So I just want to make sure and clarify a few things, and I know Captain Stone wanted to also add to that.
We have just the 2 separate units in 1 unit alone, which is male, female, in our booking units. That just the housing is 306 beds. In our booking, that's 48 beds that we have. And then over here at Unit 1, you have 118 that we can hold, as well as 16 juveniles. So that's hard for one nurse to handle. So they sometimes have to help each other. And they also have the medical system that helps, but it's hard to spread those out and to have just the one person. We have to work. They see somebody every week, every day. So they get ready for the doctor that comes in once a week. But we need the more help with the things.
Sorry, I just want to add one more thing because I forgot it earlier. Someone asked about the liability insurance for this contractor, for this company. It is in the contract that they will carry professional liability insurance in minimum amounts of $1 million per occurrence and $3 million in the aggregate annually during the entire term and any renewal term of this contract. So it's an increase.
Any other JP have a comment?
I do, Judge. It seems to me that, the mental health aspect would be something that we would really benefit from if we can try this on for size for the next several months and limit our exposure by upgrading our mental health care. I'll be strongly in support of going forward with it.
Judge.
Somebody got
I'll just make one final comment, and just loop everybody back to the beginning of this when the sheriff first brought this before the court. He said he's noticed that this has been an issue for a long time, that in our county jail that he would like to see better services provided for the inmates there across the board. So the discussion about reducing things or keeping them at the current level, the sheriff said that hasn't been enough, and we need to do better as a county. I just remind the public in the court of where this started. Thank you.
No, ma'am, you cannot. We're in the middle of discussions right here trying to get the sheriff the money appropriated for him to make his own mind up who he wants to use.
Is the way that he's gonna get it. That's what I was trying to support doing this.
Well, let's just move on. I thought if it lasted 15 minutes, it lasted a long time, and I thought I was wrong. You got a question?
I do. Judge, maybe Councilor Murphy, is there anything that prevents the mental health being submitted through the normal bid process? Like, for example, if we approve this tonight, is there anything that keeps tomorrow from sending bids out to add mental health and then come back later this summer and get that approved? How would that work?
Yeah, there's nothing that prevents it. I mean, in theory, if the sheriff wanted, he could choose whatever vendor he wanted that did not have mental health coverage. I mean, if that's what he chose, and he could fit it within his appropriation, and we could bid that out. Absolutely. I mean, that's a possibility.
All of it?
No.
Yeah. Oh, sorry.
Go ahead, you go ahead.
I was just wondering, how is mental health handled at the jail now, and is that also included in the $250,000 or so appropriation that we see for the medical expenses today?
We currently use, counseling associates, yeah. And that funding, I'm not sure how they bill on that, so Angie may give us
From my recollection, there's a cooperative agreement between ourselves and counseling associates to provide those services for the detainees because they're citizens of this county. I do not pay a bill to counseling associates, unless they provide a psychological evaluation of some sort for employee of this county. I do pay sometimes for those, but not for these services within the jail.
But as it stands right now with counseling associates, the detainee has to show themselves as they're going to harm themselves or harm others for us to call them to get a screening. With this other service, they'll have a teledoctor that comes in 16 hours a week that'll give that extra rather than shipping them out for 7 days just to come back to the jail. It gives them a continuous help and maybe even medication. I can't speak on that part, but it gives us a continuous person to see, and then it also will cut back on the transport where we have to take our transport officers to sit for an hour to 2 hours while they go speak to somebody at counseling associates.
And so what I'm gathering is, it sounds like that there may be some inmates in need of mental health services that may not be currently receiving mental health services.
Absolutely.
That would receive them if it was included in this contract. And to follow up on what you just said, in discussion with Ms. Woolley this week, she mentioned to me that not all of your jail personnel are able to carry guns. So not all of your people can transport these inmates to and from all these appointments and everything that they need right now.
So it's in our policy that you have to be able to carry a gun to transport a detainee to the hospital, to an appointment, to the dentist, to anything outside of the facility. Now, in emergency cases, we can take our jail standards who are equipped with a taser to take somebody to the ER. But that's just as dangerous.
And that need to transport could either leave the jail staff without people who could carry a gun, or just put you in a position where you couldn't transport someone. So
It can put us to where if somebody has to transport, let's say on night shift, you got 3 people in one department when you need a minimum of 4.
Thank you.
First, I'd just like to say Counseling Associates is a great organization. We're blessed to have them. But what I don't understand is if this system that we've had in place for 5 years was so broken, why haven't we been addressing this issue before now we're stuck without a doctor by July 8th? So my recommendations are get in touch with the Arkansas Medical Society, the Arkansas Medical Board, UAMS who produces new doctors, they've got postings, UCA who has nurse practitioners. There is a whole array of avenues that we can take to get an in-house doctor that will not cost this county this much money. That's my concern is financial. I'm not for this plan. Thank you.
If I may ask, Justice Rowland, what were you referring to as the last 5-year plan, or the last 5 years?
I've heard several people in the last 2 nights mention 5 years this has been a problem.
5 years that this sheriff has been the sheriff. But we
I don't know about, I will refer to when he's been sheriff. I just know that I've been told 5 years this has been an issue.
Okay, I was just.
And it's just now hit our desk, so, but thank you.
All right, let's go. Anybody else want to discuss what's before us right now? If not, we'll fix the call to vote.
Judge Baker, if I can just add one deal or one tidbit, and that is earlier I was hesitant to tell you that the rescue plan would cover the entire contract. If there is one piece of the contract that I feel like will be covered by the rescue plan, it's mental health. It's covered in the very last subsection of the federal regulation that states possible uses such as mental health treatment, substance misuse treatment, and other behavioral health services. I feel more confident in the mental health part of this contract than any other part that will most likely be reimbursable or allowable under the rescue plan.
Therefore, it would be reimbursed no matter with this plan or without this plan, correct?
No, I'm saying this portion. So
That
whenever,
portion, I understand, yes, mental health would still be covered
Right.
if we stay with our same plan.
right, but we're currently not paying, or we don't have a large, we're not paying anything to our mental health provider, so there wouldn't be anything that would be reimbursable because we're not out anything. My point is simply, if we take on a mental health expense, that will then in turn likely be reimbursable.
Thank you.
If I may clarify a statement I made about the council and associates agreement that we have, from my understanding, they have.
Allow it one time,
Thank you, sir.
and then that's gonna be it. Do you understand? Allow it one time. Okay, go ahead.
Thank you. From what I understand, they have a state bid for those services for our county to provide mental health services for inmates that do not have that care in any other, citizens that do not have that care for any other way. So that's why they were able to come and do that for our inmates, because they don't have that available care through our other plan. Thank you, sir.
I don't have a vote, but I'm going to commit. If we can get $1 out of the federal monies to go to the sheriff's office, I'm committed to doing it. If we can get $1 million out of it, I'm committed to working with the sheriff and getting it done. So any monies that's out there is eligible to go in to provide better services to Faulkner County on public health. We're going down that road. Don't nobody think we're not. Let's go back to what this meant. Are we gonna, at this time, I hear no other discussion, Madam Secretary, call the roll.
Yes, Your Honor. Allison.
Yes.
Boyer.
Yes.
Brown.
No.
Higgins.
Yes.
Kendricks.
No.
Lahosky.
Yes.
Moss.
Yes.
Pearson.
Yes.
Pickett.
Yes.
Rowland.
No.
Shock.
Yes.
Strain.
Yes.
Proposed orders 21-19 is approved, and thank you. I want to make a comment right now on my mind. I want to thank Philip, our counselor, and Justice Higgins for revising what we had the other night and took it totally out away from certain contracts and all that and put it into a plan with this ordinance. When I read it today and all, it just seemed like to me it fell in place where it should, and in the perimeter we need to be working in for. Commend Philip and Justice Higgins for doing that.
And just, can I make one comment?
Yes.
I think any JP that has not toured the detention facilities, and talk to these officers and kind of see what they do on a day-to-day basis, I think it would benefit you having a better, benefit them, have a better understanding of what these employees have to tolerate and what they do. They have an extremely tough job and it's for them we can't.
I have a letter that I will read right now under the announcements to the members of the Faulkner County Quorum Court, others to whom it may concern. Termination of my contract with Faulkner County and with the county sheriff's office was given without cause. There is no ill will between myself and Faulkner County. Faulkner County Sheriff's Office, Sheriff Tim Riles, or any of the Quorum Court or other employees. We have continued to have a good relationship, working relationship, and will continue to do so. My termination was not given based on the rate of pay set for my agreement for medical services. I appreciate the opportunity and the confidence that Faulkner County and the Faulkner County Sheriff's Office has given me to provide health care to the jail detainees over the past 15 years. Signed, Dr. Gary Stewart. And I would share it with the letter team and all of them. Appreciate it. I have no announcements. Anybody have any announcements?
Make a motion to adjourn.
Second.